Hi, so let's go and see how approach this patient. 36-year-old male, and he wanted helmet in his hairline. So this is the level of baldness here. It was grade 5 going on to grade 6. He definitely had a good density in the frontal area, which was a very small area, and then he had some scattered hairs over here, not very significant, not giving enough coverage which we wanted. And here in the eye was still the vertex area, so we had to cover the frontal, mid scalp, and the vertex. So the approach was actually to go ahead and do FUT, FUE, and body to give maximum coverage. Not willing for FUT at this point, so we went and did FUE and body. We took out from the beard. The approach was to do as much as possible. Now here, if you can see, this was not just, it was a little bit broader side also. He had lost from this parietal humps, so we had to reconstruct the parietal hump. We wanted to keep a little lower hairline. That was his intention. He didn't want a higher hairline, so we went ahead and did with as much as grafts as we could. This is the result after about a year from the surgery. You can see he's got a good growth. This is the coverage we were able to give. Still, the vertex area is, in the first setting we could not, we didn't have that many grafts. We didn't want to over harvest, so his vertex area is remaining. It's 1 year, and we went ahead and actually we have done this surgery also. It's been about 3 months since we have addressed his vertex. We are just waiting for his results of the vertex. But he was quite happy with these results, and for this he had taken vitamins. He had taken alternate day finasteride and minoxidil application. So these are some of his other views.